TFL that I talked about earlier, and I think all of you have at least heard it out running around or in some articles, Runner's World running time. So TFL, this is the muscle to TFL, leads to the ICD. That causes a lot of problems down further in the knee. But the problem is here. This is the pain that brings you into the in this position. I'm going to ask her to raise her top knee off of her bottom knee, but keep her feet together and no rotation here at the pelvis. So she doesn't need my help because she's been taught well. Right? Okay. A lot of the times, and she knows, I've asked her to go slow in the past when I did see her, because a lot of the times you'll go too quickly, you use momentum, and you're not actually using the muscle that we're trying to use. So if I slow her down, before I even add resistance, if I slow her down, then she's forcing the muscle to work. Okay. Another component of that is we need to have the brain and the muscle start to communicate a little bit better. And by doing this, we get a little bit better what we call neuromuscular re-education. So the communication is a little bit better now. This is a marriage that went to counseling. Okay. So thank you. Okay. So if it's your first couple of sessions, the first couple times you do this one at home, I would just say go until fatigue, no set number, because you'll get locked into numbers and you kind of lose the effectiveness of the exercise. If you go slowly, and for her and for everybody that I speak to, it's 5 seconds up. 5 seconds is all the way up without the pelvis rotating. The way that people are going to cheat is you're going to rotate that pelvis back. So you're going to keep that pelvis straight, like stacked on top of each other. Hold for 5 seconds, and then down to the slope down to 5. So it should take you about 15 seconds per repetition when you're doing these at home. If you find that you're cheating and rotating the pelvis back, that's when I suggest you get on the floor and put your back against the wall so that the wall prevents you from rotating back. Okay. All right? And we have 2 legs, so certainly we do both. But if you're having a problematic side, I would emphasize that one side more than